Hi, I'm Yvonne Ramirez, and I'm the Vice President for Human Resources and Diversity Officer for the Einstein College of Medicine. I'm delighted to be here today to welcome you. We want you to know how important you are to our future and that we're glad you're here. It's important for new people to know some basics, to understand what it means to be part of Einstein.
And the hue changes depending on the orientation.
The Albert Einstein College of Medicine is a research-intensive medical school. So we're training MDs to be compassionate, scientifically excellent physicians. At the same time, we do research and we uncover new knowledge in biomedical discovery that is aimed at improving human health. We have as our catchphrase, science at the heart of medicine.
This is UV clear.
It is.
I'm Vern Schramm, Ruth Mearns Chair of Biochemistry. We study the transition states of enzymes because they're critical for all of life's processes. We've used that information then to design antibiotics. Hilda,
Hi,
what are you making?
I'm doing structures for the paper.
Oh good, I see that's the reaction. This is a wide-ranging program, can be used for any kind of human disease.
Our social justice mission is deep-rooted in the very letter from our namesake, Albert Einstein, that hangs on my office wall.
In the 1950s, most medical schools had exclusionary rules in their admissions process that excluded women, it excluded Jews, it excluded people of color. The president of Yeshiva University at that time was Dr. Samuel Belkin, and he wanted to actually create a medical school that was different than all the others in this country, not only in terms of excellence, but he wanted it to become a meritocracy. And it was that vision that Dr. Belkin presented to Albert Einstein and said, we want to immortalize your name for this type of institution. Einstein was very touched and sent a letter of his great support.
And his letter to us signified that Einstein would be a school that admitted students of all races and creeds and would truly be inclusive and serve humanity. This was his mandate to us, and it's one we've taken very seriously. Our location, our commitment to both underserved populations as well as in a global health sphere really indicate that we walk the walk and don't just talk the talk. What is unique, and I hope is preserved and cherished in the United States, is this opportunity of someone who comes, as I did, as an immigrant, born in a displaced persons camp in Germany after World War II, to be able to use motivation and whatever innate talent for really the public good.
Einstein's mission is to create great physicians and great scientists who are dedicating themselves to improve the world. Every single person that works at Einstein is contributing to that mission. Every single person is doing something that if that person or that group or that department was not there, we couldn't do what we do best.
Hey, good morning, Scott. Hey, Louis, how's it going? Everything good, how about you? My name is Louis Maldonado. I'm a chauffeur here for the receiving department at Einstein. We're the department that interacts with every other department. We work with PIs, students, faculty, staff. We're delivering packages to every single place in this college. We deliver stuff that the research needs to do the experiments. Every lab, each floor, every office, that's where we're at.
Good morning.
Thank you so much.
My name is Sveta Webb, and I'm an administrator in the Department of Medicine. My job is research operations, so it's basically operations, finance, HR, making sure different departments work together. I've been working here for about a year. If you're a new employee, you can ask anyone a question at any level. People want to help you.
What makes Einstein unique is the people. People are really selected to come here, work in the Bronx to achieve excellence. We're recognized for that not only in New York, but throughout the world.
This just refers to the fact that a certain disease or medical phenomenon can be observed and can be attributable to a genetic change.
Einstein's education mission involves both MDs, PhDs, our graduate school, and then the medical scientist training program, the MD PhDs. And in each of those three categories, Einstein has really achieved excellence. We have now typically over 8,000 applications in the medical school for 183 positions.
If you were to rate the pain on a scale of 1 to 10, where would you say the pain lies?
Our MD program absolutely attracts a very unique kind of student. Students with a real degree of altruism, wanting to serve the underserved populations locally, but also involved in global health endeavors. Our integration with Montefiore really redoubles our commitment to social justice because Montefiore has been viewed as a hallmark of a health system that has social justice at its core. It's also a new era for Einstein as part of Montefiore with regard to the opportunities in biomedical research and discovery.
Already we're making moves to collaborate more closely together and to think about taking our science directly from the lab bench in the research lab like this and move it towards the clinic in patient care.
I think when you work here, they don't set you up to fail, they set you up to succeed.
The benefits, salary, everything here. They are taking care of my needs, and not only mine, but my family's.
Getting up in the morning, coming to work is really one of the joys of my day. I get up, throw on my clothes, feed the cats, and immediately rush to work.
This is the place where our future doctors is coming from, or they're finding the next cure for the next disease. You know, I feel that there's no better place to work for than this organization.
It's never a mission accomplished. There's still so much to be accomplished.
I truly believe that if we're going to be successful, you need to understand that it's not just what you're doing for us, it's what we're doing for you. We're lucky to have you.